Okay, in this video, we're going to be talking about an electrocardiogram, often referred to as an ECG, or if you're German, EKG. And I like the way EKG sounds, so oftentimes I use that. Okay, so with this video, we're going to go through a bunch of waves, segments, and intervals. Okay, and so we're going to start off, and I'm going to highlight these in red. We're going to do waves. Okay, so we've got our P wave here. And so this is the first wave that's occurring in the EKG. And so a wave is just some place where we can measure electrical activity. Okay, with the P wave, and so I'll write this up here, the P wave is where the atria are depolarizing. So we've got atrial depolarization. Okay. Next, we've got three different waves that we lump together. And so we've got Q, R, and S. And so that's called the QRS complex. And so during the QRS complex, we have two things that are going on, but we can only see one of them. So we've got ventricular depolarization, but we've also got atrial repolarization. Okay, and so it's occurring, but you cannot see it on an EKG. All right. And then here you've got the T wave. And so the T wave is ventricular repolarization. Okay. So depolarization, just think of it in terms of that chamber or whatever is getting ready to or it is contracting. Repolarization, it's basically getting ready to or it is relaxing. All right. And so here we've basically got two complete cardiac cycles. And so we've got P, Q, R, S, and T. Okay, so now let's talk about two segments. All right, and so we'll do the segments in, we'll do them in white here. Okay, so the PR segment goes from here all the way to the beginning of QRS. So right here is PR. Okay, and so with PR, this is the time, I hate that I do that all the time. So PR is just time AV node holds the signal. Okay, remember the AV node, its job is to hold the signal and then send it along so ultimately the ventricles can contract. But the reason we want it to hold on to the signal is because we don't want the atria and the ventricles contract at the same time. It would be inefficient. Holds on to signal. Okay? All right, and then from there, we've got the ST segment. And so the ST segment goes from the end of S, and it goes to the start of T. So this is this little thing right here. So ST, and so with ST, this is just when the ventricles are fully depolarized, okay? So those are the two segments. Okay, now we've got two intervals, and actually I'm gonna do three intervals. One of which is not talked about in the video. I won't necessarily quiz you on it, but it might be something that you talk about in lab, so I'm going to mention it here. All right, and so for the intervals, we'll do hot pink. And so we've got the PR interval, which goes from the beginning of the P wave until the start of the QRS. Okay, so I'm just going to put this here. So that's your PR interval, and I'm going to write about it up here. So the PR interval okay, this is how long it takes everything to get through. So time it takes signal to go through the atria and AV node. Okay. So basically we start depolarizing the atria. How long before that signal is sent on to the ventricles? Then we've got the QT. And so QT also starts here. So I'll put another line. It goes from the beginning of Q until the end of T, okay? And so just so it kind of lines up here, so it's this one right here, okay? So QT, we'll write down here, so the QT interval Okay, this is basically the time that the ventricles are depolarizing and repolarizing. So depolarizing and repolarizing. Okay, and just to be clear here, I'm going to put, so it's the ST segment and the PR segment. Okay. And then we've got one more. And so like I said, I'm just going to talk about it here. So it's what we call the RR interval. So we have RR, and this shouldn't surprise you. If it does, it's okay. But it's the time from one R to the next R. Okay. And this is how we measure one complete cardiac cycle. It's the easiest thing to measure, right? Because everything else is kind of rounded. So look at rounded here. It doesn't always look this pretty. So if it's kind of skewed, like where's the top? What about the next one? That sort of thing. But the R is very peaked. And so it's really easy to identify. And so we use the RR interval to determine the length of the cardiac cycle. And then depending on how long that cardiac cycle is, in number of seconds, we can determine what your heart rate is. And so, for example, let's just say that your RR interval is half a second. Well, all you have to do is you go, it helps you do this. You go 60 divided by 0.5, and that equals 120 beats per minute. So that's how you determine heart rate. So heart rate equals 60 divided by the RR duration. Okay. And with that, that's the EKG.